We've become familiar with a lot of people we may not have known if it weren't for the pandemic. Doctors, nurses, epidemiologists, and advocates. People who stepped up to really help us make sense of a scary time when everything else just came to a stop. We caught up with 3 of those people to find out what the last 3 years have been like for them.
I'm Vivian Stamatopoulos, and I am a long-term care advocate and an associate professor at Ontario Tech University.
My name is Samir Gupta. I'm a respirologist and a scientist, and I work at the University of Toronto.
Hi, I'm Fahad Razak. I'm an internal medicine physician at St. Michael's Hospital and a professor at the University of Toronto.
I don't remember exactly where I was, but I remember I was grieving for my grandmother who had just passed, and I was in the process of preparing a funeral and dealing with everything you have to deal with after the death of a loved one, who coincidentally also died she was living in a long-term care facility.
I was probably curled up in the fetal position somewhere. No, I think it was a clinic day for me, so I was at work. But I think for a lot of us in healthcare, we weren't waiting for the World Health Organization to declare it. A lot of us had heard from colleagues in Italy. Some of us had heard from colleagues in China. We understood that this was something serious.
I was working on the wards at St. Michael's Hospital. We were starting to hear about the virus. We were worried by some of the early evidence saying that it could cause really severe disease, and we were starting to think about how are we going to respond to this thing? What can we do in hospital to make sure we have enough capacity?
Well, I remember just feeling fearful, and particularly fearful for what was to come for long-term care residents, because my mind was just completely one-track mind with what had happened to me and my family with long-term care. And I was just concerned with everything I was hearing in the news about how long-term care was being impacted in other countries, and I knew it was going to hit us.
I think, not particularly that moment, but that whole period of time was just a very scary time, I think, for everyone. And it was no different for us in healthcare, maybe heightened because we knew that we would be facing this, that we would be trying to help these patients and being exposed to this virus. And there was still lots and lots of uncertainty at that time about, how we would diagnose it, how we would treat it, what precautions were required, how it was transmitted. None of that was really known at that time. So that was a very frightening time for all of us.
I remember thinking about my family a lot. So when the pandemic started, we had our first child who was just over the age of 1. I have elderly parents in Windsor, Ontario, who were the kind of high-risk patients who looked like they could get very sick if this virus came through. And I started to wonder about how they were going to be protected while we were going to probably have to work some pretty long hours in hospital to keep things afloat.
It's changed in lots of ways. I think for people in healthcare, like everyone in the world, life has changed. A lot of realizations have come. I think for me, I've always been interested and involved in science communication, but one of the things that's changed is the nature of that science communication. Before the pandemic, it was largely about celebrating advances in health science. It was talking about major discoveries or really important trials. Since the pandemic, I find that it's been largely about misinformation and disinformation, trying to combat that.
The pandemic has really changed the nature of almost everything we do in hospital. The last 3 years were an incredible stress and strain and a roller coaster of emotions. Worried about taking this disease home to our family, how are we going to manage in hospital? And then how are we going to help people around us? And the role that I was able to take on the science table was one of the biggest privileges of my life, to be able to help on the science table, but also a lot of stress and a lot of late nights. And so I think I feel like I have come through a bit of a tunnel these last 3 years, not on the other side of it yet, but feel like a very different person now than I was at the start of the pandemic.
I can say that my research shifted towards long-term care, primarily motivated from my own experiences, which then, melded into my advocacy, and then all the experiences connecting with families, across Ontario, but also across Canada. I mean, the pandemic revealed glaring ageism, glaring sexism, glaring racism, and glaring ableism. The intersectionality of all of these things has been the main reason why this population was harmed as much as it was. Keep in mind, this is a largely older female adult resident population with, disabilities that are being cared for by a largely female racialized worker population, many of which are women that are new to Canada, and they are being exploited and set up in conditions of work where they are bound to fail.
I think I probably should have known this, but I think the pandemic really drove home for me that even a scientist or a doctor, when they're looking at information, is very much influenced by their political views and their worldviews. And you can have a scientist looking at the very same scientific data, but two people with different worldviews will interpret that very differently.
Nothing like this has ever happened, but we managed and we avoided some of the worst outcomes we saw in places like Lombardy, Italy, and New York City. That said, the real shocking first experience of the pandemic for me was what happened in long-term care. It was unlike anything that I've seen. And I think it's a really dark mark on the Canadian experience of how we protected the most vulnerable among us.
No, I think it always amuses me when people are like, oh, you're that girl, that long-term care girl, or like if I'm ever out and I don't have my mask on, people will sometimes recognize me, and I'm always nervous and uncomfortable because it's not something that I feel, a natural doing, but I have an education that has allowed me to find the data and to find the evidence and be able to use my firsthand experience to communicate a message in a way that apparently is connecting with people. And if that's working, right, and if that's getting some things to budge, if even a little, and to get that ball rolling, well then, you just got to keep at it.
Yeah, definitely not. I'm an engineer originally by training before I went into medicine. These are not professions that train you how to communicate with people. And there was a lot of missteps. Myself, my colleagues, I think it was a real learning curve about how to talk about things honestly but clearly, tell people when we were worried in a way that wasn't alarmist, being able to be reassuring when we thought things were going well. It's been a steep learning curve, and I think one of the questions is what we as health professionals or others could do better in terms of our communication skills. I think it's one of the big learning points coming out of the pandemic.
Yeah, I think I had done science communication for a long time before the pandemic, but certainly the frequency, the nature, the urgency of it changed, and the type of work changed a lot too. Much of what I had done before was television or radio, was conventional media. And the importance of having scientific voices on social media really came out during this pandemic because of all of the misinformation and disinformation that was on those channels, and because that's where a lot of young people get their information. It's the only place they get their information. So I think that's one thing that really changed for me is where I do my science communication and which kinds of audiences I'm trying to inform now.
Look, as a physician, as a scientist, I never thought that I would have a job that would allow me to help in this kind of crisis. I was trained to be someone who would do a lot of statistics and work on the wards to care for patients, but suddenly the work we were doing had broader impact about how Canada was going to weather this once in 100 years crisis, really. And so I think the ability to do that and to help has been motivating for all of us. When I look at my colleagues, we feel like we've been able to get out there and help most of the time. We've made our mistakes, but we hope that we've been able to help, and I think that really helps us continue to do the work that we do.
Every family member I've spoken to, every resident that I've connected with, every frontline worker, I mean, when you hear the stories and what they went through, I mean, not for nothing, it changes you. You can't stay quiet when you hear firsthand what happened to these people. I mean, it was abject negligence, complete failure, and governments just failing to use proper resourcing to protect both the workers and the residents in these facilities. And I don't see much that has improved, however frustrating it is, seeing how little meaningful change has occurred. You still have to keep going, because someone told me once, you don't realize it, but at some point, something will shift. And it might take a while to get there, but you got to keep fighting. So don't give up, because trust me, you want to give up quite often when you've been doing this for 3 years and you feel like nothing really is improving all that much, that it could be. but nobody's doing what needs to be done.